When people are looking at treatment options for tooth replacement, often dental professionals will discuss dental bridges and dental implants. What are the differences between the two? When is one more appropriate than the other? Who better to ask than Dr. Pashmini? Welcome.
Thank you.
All right, dental bridges, implants. When are they appropriate? In which cases?
Of course. So let's say you come to me and you're missing a tooth. If it's a single tooth problem, how do we fix it, right? Like, do we obviously always have the option of a removable denture. That's always the last option we ever consider. Nobody likes their teeth coming in and out when they're eating. But I will bring an example of a patient that I had that came back to me after 2 years. 2 years ago, we saw her. She's missing a tooth on the lower left side. We recommended a bridge mainly because there were a lot of mainly for economic reasons. So let's go back to cost-wise. That's usually where it comes down to the patients. Some insurances cover implants, some insurances cover bridges, some don't cover either. Usually we discuss that with the patient, but if we put the cost aside, usually for a single tooth replacement, it's a single tooth problem. We want to keep it a single tooth solution, meaning we don't want to involve the teeth next door. We don't want to involve our neighbor if our roof is broken, right? So that would be a good option for an implant. Now, implant, obviously, it's a surgical procedure. It does require a healthy patient. So if a patient is diabetic or if they smoke a pack a day, I don't personally recommend implants. You can go into any office and the first thing they'll throw at you is a dental implant. For me, it's more case by case because implants are meant to stay in your body for the rest of your life. If you have a health concern, again, if people have heart issues where it doesn't allow them to go through invasive procedures, if they have sinuses that are low and it's going to require extensive surgery to lift the sinuses to open room for the implant, obviously that's something that needs to be discussed with the patient. Not everybody wants to go through all of that. But ideally, for a healthy patient who has healthy bone, we go the implant route. That's the ideal because it's just involves one tooth, replaces the tooth you're missing, does not involve the neighbors. The second best option is a bridge. Bridge is still something that's not removable. We do involve the neighboring teeth to get the bridge in place. So a bridge is 3 splinted crowns, and one sits on each adjacent tooth to the space. And there will be a fake tooth in the middle replacing the tooth that's missing. Problem is we are involving the teeth next door. Usually crown and bridge work needs replaced every 10-15 years. So every time we replace the bridge, we are taking more tooth structure away. We are kind of extending the problem to the adjacent tooth. So is it a good option? It's a great option for some patients. Implants are not the option for one patient all the time, and it's not the same with the bridges. The main requirement for a bridge is you need to have a tooth on both sides of the space. So if you're losing that last tooth on the top, bridges are no longer an option for you because we have nothing to bridge it to. But if we can, we try to get an implant in. That's usually the standard of care these days. But we also consider everything else. Patient that came back to me today after 2 years, I had told her the best option for her would be a bridge because the teeth next door already had crowns on them. The crowns were already breaking, so we had to replace them anyway. So the easiest way for her would be to put a fake tooth in the middle and splint them all. Patient went somewhere else. They told her implant only, gave her a hefty treatment plan because her insurance doesn't cover it, and now she's back here. She's scheduled with me tomorrow morning to get that bridge done. So it's not one size fits all. It's very much tailored to your teeth and to your needs and to your medical history. And if somebody lost their own natural tooth because of gum disease, I am not putting an implant in that jawbone. Believe it or not, the implant is also going to fail. So there's a lot of things that goes into deciding which one's a better option for the patient.
Right, and your dental professional is the one to talk to because we see a lot of commercials and everything, implant. But to your point, there's a lot of individual situations and cases that need to be analyzed first and recognize the best treatment going forward. So, okay. Well, there you go, folks. Bridges, implants, insightful. Have that conversation, get that tooth fixed, get that
Go
gorgeous
to your
smile.
dentist, ask a question. Do not ask ChatGPT to give you the answer.
No, no,
it's
no.
it's a dentist question.
All right.
Yes.
Well, very helpful as always. We learned a lot today. Appreciate your time, Dr. Pashmini.
Of course, thank you.